Hi everyone, my name is Dani Larkin. I'm a Bundjalung and Kanarakan woman from Grafton, New South Wales. I grew up on Bundjalung country at Grafton and just outside of Grafton, New South Wales on a little remote Aboriginal community in the bush called Baryugal. That's where my mum's side is from and my father's side is Kanarakan from the Northern Territory. Before I pay my respects and acknowledge country, I'd like to welcome everyone to this conference, Health and Human Rights in the Climate Crisis, Charting Challenges and Solutions. What a great platform to discuss important issues we're faced with in this time of crisis, and an impressive lineup of speakers to share their expertise on those issues. As an Aboriginal woman, legal academic, Deputy Director of the Indigenous Law Centre at UNSW, and Advisory Committee member of the Australian Human Rights Institute, I'm comforted to some extent that we have forums like this of intelligent, progressive academics, experts who share the same view of myself and many, which is to prioritise the addressing of challenges that have arisen, which we're faced with from the threat of climate change and its impact on our health. I've seen over the past few years how different tribes have had limited access and ability to exercise their sovereignty and self-determination rights through practice of their culture because their local rivers have dried up due to drought. Rivers significant to the identity of their land and of their tribe. Rivers who have seen generations of mob pass on invaluable information to their young on how to survive off the land and the river and to nurture it and sustain it. But some things are more powerful than us ourselves. A lack of interest and proactive action by our government is always an overarching barrier to First Nations of Australia, no matter how hard we try to preserve our land and our culture. I've seen the ongoing advocacy and activism of mob from the Torres Strait Islands who are faced with their land sinking as a result of rising sea levels, coastal erosion, extreme weather, and destructive king tides. Global warming is a real thing and it's happening. But when we speak of how that relates to the health and well-being of First Nations, it affects us in more ways than one. Many people on the Torres Strait Islands, particularly those who live in the places under the most threat, don't want to leave. They love their land. Land sustains them and fulfills their heart and their mind, their body and their soul. It's the core of Aboriginal and Torres Strait Islander cultural identity and what you'll find with all Indigenous cultural identities around the world. But our constant struggle is to keep convincing and showing the Australian government how to shift its ideas about ownership over the land to an outlook that's more humble and giving instead of taking. Our way, blackfella ways, are not about us owning the land. The land owns us, and we as its guardians, its custodians, are responsible for protecting it, sustaining it, and letting the land restore and replenish when she shows that she's sick and that she needs it. And when we do, we fulfill our cultural obligations, which makes our heart full. We become happier and more content people. Our integrity is strong. Our bodies become physically stronger because we're surviving off the land that we give to and we protect it and it gives back and protects us. So with that in mind, I'd like to pay my respects to elders past and present and any other Aboriginal and Torres Strait Islander people attending this conference and acknowledge country in Bundjalung language. Dingila Widjul Yangang Bayang, Mala Bundjalung Kanarakan Dobe, Garama Jagun, Garama Nanang Banang, Buguma Mala Gadago Jagun, Bugube. And just to translate that, I was just acknowledging and paying my respects to my brothers and sisters that are in attendance of this conference, acknowledging that I'm a Bundjalung and Kanarakan woman and pay my respects to being on Gadigal country today. Thank you, everyone. I wish you all the best with attending this conference, and I send much love to the speakers presenting on such important issues.
Thank you so much, Dani. Good morning, good afternoon, or good evening, depending on where in the world you are joining us today. My name is Justine Nolan, and I'm the Director of the Australian Human Rights Institute at UNSW Sydney. It is my distinct pleasure to welcome you on behalf of our co-hosts and co-sponsors of this event, the Institute on Inequalities in Global Health at the University of Southern California and the George Institute for Global Health. Today, I'm really excited to kick off with our opening session for our conference, Health and Human Rights in the Climate Crisis, Charting Challenges and Solutions. But let me start first by thanking Dr. Dani Larkin for her amazing acknowledgement of country that clearly recognises the importance of aligning people, culture, and the state of our planet. I'd also particularly like to thank two of our other principal sponsors for this conference, Maurice Blackburn Lawyers and the Ingram Fund for International Law and Development. We all come together for this conference from all over the world at a critical time. We are now just a week away from the start of COP26, where the world will stop, once again, to ponder global action to tackle the climate crisis. The consequences from the climate crisis for our health are both real and devastating, and they are happening now. The symptoms of climate change, extreme temperatures, floods, heat waves, droughts, fires, are manifestly clear, as are the treatments. In this conference, we're asking, what will it take to shape the world from further delay and denial in the face of this threat, in the same way that countries mobilise to tackle a global pandemic? What if we treat climate change like a disease? In the last few weeks, we've seen a crescendo of voices united in a call for collective action with an understanding that we're fast approaching the world's best last chance for action on climate. The World Health Organization has just released a report emphasising that climate change impacts health in every country around the world. No one is immune, and any delay in acting on this global health threat will disproportionately affect the most disadvantaged. Their report, which was released in the lead up to COP26, and we might assume this conference, is a call to action not only for government, but also for business. Just recently, the United Nations Human Rights Council recognised for the first time the human right to a clean, healthy and sustainable environment. It also appointed for the first time a UN Special Rapporteur on climate change. And more than 300 organisations representing 3/4 of the global health workforce have released an open letter to governments warning that the climate crisis is the single biggest health threat facing humanity. What has become increasingly evident is that the fundamental principles of human rights, of equality, of non-discrimination and of equity must be firmly at the centre of the climate debate. The climate and health crises are two sides of the same coin. Therefore, strategies for resolving them demand an integrated approach. And in doing so, we need to confront the inequalities that lie at the root of so many global health challenges. Our aim with this conference and its 9 days of discussion is to showcase research and debate that draws on a wide range of experts, from public health to climate science, to law, to business, to human rights, to discuss global developments to address climate change. We have deliberately curated these 9 days of short sessions to enable us to be as inclusive and allow as many people as possible to participate. In co-curating this conference with our partners, USC's Institute on Inequalities in Global Health and the George Institute for Global Health, we are recognising that the time for acting is now. There is no more time, as Greta has said, for blah, blah, blah. Starting with this opening session featuring two global leaders on climate and health, the Right Honourable Helen Clark and Dr. Tlaleng Mofokeng, we will emphasise that the health of the people and the health of the planet are intimately connected. We have over 30 speakers from around the globe who will debate, agree, and hopefully disagree about how we move forward. In future sessions, we will explore how the discriminatory impacts of climate change are affecting some of the world's most vulnerable peoples. We'll address how economic inequality impacts our health responses to climate and consider the role of government, business, and civil society in tackling this challenge. We will also discuss the endless dithering by the Australian government in developing a coherent response to the climate change. Australia is acting as a handbrake on climate progress, and we would like that changed. While there is much to be depressed about when talking about the climate impacts on health, we're also going to be solution-oriented and somewhat hopeful. We'll be hosting a session with 3 renowned artists looking at the art of climate health, and we'll close the conference with the voices of 4 young climate activists from Australia, the Pacific, and the United States, who are here to remind us that they will not be denied their future because of a failure to act on the climate crisis, and they will not be backward in telling us where we've got it wrong and how we need to get it right. So let us begin today with 2 remarkable leaders who will each provide some opening comments, followed by questions posed by 3 of our amazing students, 1 from each of the hosting institutes. You are most welcome to add questions into the Q&A chat box that we hope to get to if time permits. It's now my pleasure to introduce the Right Honourable Helen Clark, former Prime Minister of New Zealand and former Administrator of the United Nations Development Programme. She has devoted most of her life in pursuit of public service, more than 27 years in the New Zealand Parliament, including 9 as Prime Minister, and served 2 terms leading UNDP. During that time, she was also the chair of the UN Development Group. She was the first woman to assume each of these leadership positions. She's never been one to shy away from controversial or tough issues. And this year, she was appointed by the World Health Organization as the co-chair of the independent panel, which reported on responses to the pandemic. She has also established the Helen Clark Foundation, a public policy think tank, which focuses on initiatives to achieve a more inclusive, fair, and sustainable society. She's long been a champion of both inclusive and sustainable development. But in all her roles, she's not only championed issues such as diversity, equality, and sustainability, she's acted on them. And she's achieved so many formidable firsts that there are too many to recount in this brief introduction. So I'm now very pleased and honoured to welcome Helen Clark to open our conference.
Greetings, everyone. Ena iwi, ena reo, ena rangatira ma tēnā koutou, tēnā koutou, tēnā koutou katoa. I'm greeting the tribes present. I'm acknowledging the Indigenous language of New Zealand and the chiefs, and greeting you all and thanking Dani for the very moving acknowledgement of country and reminding us what we're doing to our planet is doing to the lives and prospects of Indigenous peoples around our world. Let me also acknowledge our Pacific friends who are so threatened also existentially by climate change. Talofa lava, malo elalei, whakalofa lahi atu, kia orana, nisambula banaka, and warm greetings to you all. Well, listening to the 2 introductions and to Justine listing just the most recent reports coming out on the threat of climate change to health and human rights, the WHO one, the Human Rights Council's acknowledgement, and also the special rapporteur appointment, and knowing of the body of other reports that's accumulating. It's almost like we say, what more do we need to know before governments see the need to act? When I was at UNDP, I followed very closely each year the UN Environment Programme and annual assessment of the emissions gap report, which always looks at where are we at with pledges to reduce emissions and where do we need to be. And they produce around December each year. The one from last year, and I assume another one is imminent, timed for the COP, which is so close now in Glasgow. The last one was telling us that we're still heading for a temperature rise in excess of 3 degrees this century. And as we can all recite in our sleep, 3 degrees is catastrophic. I don't like using the term catastrophic because it's easily used, but it is. We see what's happening now, even before we peak at 1.5 degrees, and the aspiration of Paris is to stay under the 1.5. Time is running out. Even 3 years ago, listening to senior members of the Intergovernmental Panel on Climate Change presenting in Hanoi on their then assessment, they said, look, it's economically, geophysically, and technologically possible to meet the ambition of the Paris Agreement. But each day, each week, each month, each year that goes by, it becomes tougher without meaningful action. And of course, perhaps the factor they were too diplomatic to mention was, is it politically feasible to do it? Because I am of the opinion that achieving the ambition of Paris is about political will. And if you don't have political will and leadership, it's very, very difficult. And that's why the mobilization of people at the grassroots across our societies is so critical, to put the pressure on governments to know that they do not have a choice to act. They have to act. Now, the Glasgow COP is an important one. It's delayed a year. And that also means that what's known as this ratchet mechanism, whereby the commitments which countries made on their greenhouse gas emission reductions and what they're doing on adaptation, this is also delayed a year. And again, delays aren't helpful. Now, every country is supposed to submit an updated nationally determined contribution of what they're going to do. And as of the end of September, there were no new or updated targets from 70 countries. And I understand that as of that time, both Australia and New Zealand had submitted without raising ambition. So we're a bit in the dog box here, aren't we, as countries in the south of the Pacific? It's not a good place to be, particularly when we have this big emissions gap action figure from UNEP. So let's come to the point of health as an entry point to bring more people on board with what needs to happen. And the health impacts are just so considerable. And Australia is so on the front line of this, which is why it's often frustrating to see the political debate in Australia. Look, as a Kiwi, I've got Australian relatives, people who went across the ditch years ago to live. We hear from our cousins in Sydney. We hear what the summers are like. It's becoming very difficult to survive an Australian summer. It's unbearable outside in these horrific temperatures. And that's a daily reality in South Africa, in South Asia, in the Gulf. I remember years ago, probably 10 years ago, launching a UNDP report on looking at scenarios of what was happening to the environment and to inequality, and the projections being that life would become unbearable in parts of South Asia and the Gulf with warming temperatures. But I suggest that it's becoming unbearable in Australia as well. And the problems of this, particularly where you're faced with huge inequity and development challenges, are death through heat stress. I think also of the Australian fires, which before the pandemic we were mesmerised by the Australian fires. The effect of smoke pollution on people's health. Think of animal health. I mean, among the most tragic images from the fires were what was happening to Australia's Indigenous animals. It was simply heartbreaking. And of course, climate change also brings with it the health risks of the mosquito-borne diseases, going to higher altitudes than before. Altitude, not a particular issue in Australia, but take the Andes, where the mosquito-borne diseases are steadily coming up the altitudes. The breeding seasons for ticks, the deer tick Lyme's disease is one we perhaps know a little bit about. The breeding season for that is expanding significantly. Then we think of the extremely adverse climate events and their impact on health. And, Australia and the floods, think of your floods. Think of our floods here. Think of our floods in Germany and the Netherlands. I mean, these are huge events for human health, of course, affecting water supply, the forced displacement, which comes with adverse events like that. And forced displacement is an unhealthy and unsafe place to be for many, particularly for women and for children. The other side of the coin, of course, is the droughts. Australia also knows a great deal about drought. Where you have a combination of extreme drought, and how many times do we hear it's 1 in a 100-year drought? Well, it seems to come around rather more often than that. But take the belt from the Sahel hopping over the Congo forest through to the dry lands of the Horn of Africa, where you have the combination of extreme poverty and vulnerability, levels of conflict, and then add more recurrent drought into that as well. Drought plus conflict equals famine. And we're on the brink of famine so often in those environments. So the health impacts are really extreme. And that's why I welcome a conference like this, which focuses on this bigger picture of the linkages between what's happening to the planet, our health, how it impacts on our rights, how it impacts on our capacity to realise our right to health. It has a very, very serious impact on that. Now, I think before winding up introductory comments, we have to believe there is a way through this, and I believe there is, but it does need political action. Getting political action means really increasing the pressure from citizens on governments as to what expectations are. I think we also got, a window into what the world could be like through the periods of lockdown in much of the world in that March to May period last year, with, for the first time in living memory, people in Kathmandu could see Mount Everest, where air pollution levels in Delhi got to satisfactory levels, which they never were during business as usual. I know that quite a lot of New South Wales and Victoria has been in lockdown, and while it has its huge frustrations in so many areas, and also its impact on health and well-being, nonetheless, during a lockdown, we do notice that the air quality is better, and we can hear the insects and the birds. So we get a kind of insight into what a world with a lower fossil fuel imprint on our lives could be. And as the Intergovernmental Panel has told us, and I repeat, there are solutions. This is technically, economically, geophysically possible, but we need action. And we need more action at this climate change COP. I see the Australian Prime Minister is going, and let's hope going with something more to say than Australia's had to date. I would not expect Jacinda Ardern to be going. We're grappling with a Delta outbreak here, which she'll want to see put to bed. But we need a lot of pressure now on what's going to be said at that COP. Justine, I'll throw it back to you.
Actually, you're throwing it back to me, but thank you, Helen Clark. That was wonderful and just what we needed to hear. I think we're so grateful for your wisdom, for your warmth, and for your leadership. I'm Sophie Gruskin of the USC Institute on Inequalities and Global Health, one of the co-conveners of this amazing conference, and based in California, where we, like the rest of the world, are increasingly suffering adverse climate events. And I want to take this opportunity to welcome everyone and just to say how thrilled we are to be part of this incredible experience, where really it feels like coming together in this way, we're going to be able to make a difference for climate, for health, and for human rights. It is my great honor to invite Dr. Tlaleng Mofokeng, the UN Special Rapporteur on the right to health, to help open the conference. I want to say a few things about Dr. Mofokeng. She is, as her bio says, a medical doctor with expertise in universal health coverage and HIV care, in youth-friendly services, and family planning and sexual health. She's the member of the Safe Abortion Action Fund, the Global Advisory Board for Sexual Health and Wellbeing, Accountability International, chair of the Soul City Institute Board. You can read her full bio, or at least the more detailed bio on the conference website, but it doesn't capture the half of it. So allow me to say a few things on the personal side. First, she's strong and she's brilliant. Second, she has a great sense of what's right and what's wrong. And she's been great about using this in ways that are good, not just for individual patients, but for the health and rights of the greatest number of people, which is why the link between her work and climate makes so much sense. And finally, she's taken on and brought such amazing energy to this rapporteur role. I am and I think I speak equally for all who follow the work of this mandate, incredibly grateful for the depth and the breadth that she's bringing to the role. I truly believe she has the right energy, commitment, and brilliance to get us thinking about climate in new and important ways, and that she's the person to help move the right to health forward, even in this very complicated and difficult time. Tlaleng, the floor is yours, and thank you again for being here.
Thank you so much, Sophia, for that introduction. Really humbled by those words, and thank you very much also for inviting me to share the space with all of you. And as much as I'll be sharing my thoughts and ideas, I'm also going to be learning a lot. And for me, the main thing is about the interdependentness and the interrelatedness and the indivisibility of human rights, and how climate health and healthy environments are crucial for the realization of the right to health. And so this convening for me is important for the mandate to share, but also to learn. And for millions of people throughout the world, the full enjoyment of the right to the highest attainable standard of physical and mental health remains a distant goal. And in many cases, this goal is becoming even harder to reach. And today is an opportunity to observe and maybe even celebrate the decision by the United Nations Human Rights Council to recognize that access to a healthy and sustainable environment is a universal right. And it's an important opportunity too to acknowledge, perhaps with less celebration, that despite the tireless work of civil society and indigenous and environmental activism across the world, we are still facing a time of last chances to turn the tide of climate change and the crisis and environmental destruction. And though it is indeed a wonderful that this resolution of the Human Rights Council has been passed, we are facing down the barrel of an environmental gun, so to say, and we have no choice but to do the work with the resolution calls for. And just taking us back to 1972, when the UN held the Conference on Environment in Stockholm, as part of the conference included what became known as the Stockholm Declaration, which led to the beginning of the UN Environmental Programme. And this declaration had 26 principles at the time that placed environmental issues at the forefront of international concerns and marked the start of a dialogue between industrialized and developing countries on the link between economic growth, the pollution of the air, water, and oceans, and of course, the well-being of people around the world. And we cannot assess the environmental crisis without acknowledging the ways in which the legacies of colonization has created industries that have no regard for the well-being of living beings as well as the earth, and are only seen only for their capacity for labor and profit and extraction. The exploitation seen at the forefront of this crisis has its origins in colonial conquests, and I implore us to see how these legacies live on today. And reversing climate change must go hand in hand with developing an anti-colonial, sustainable industries that serve everyone without the need for exploitation. And that demands us also to look at capitalism and how it sustains exploitation. And there may be those who say this is not possible, but alongside these industries have been centuries-long examples of sustainable indigenous practices to model industries after. And of course, human beings are complex. Neither one of us are simply one thing. Similarly, we ought to think about human rights as interconnected as opposed to isolated. Therefore, environmental rights are as essential as all other human rights. It is important that we take environmental rights seriously, because when they are ignored, it is the most vulnerable in society that are most affected by the negative outcomes. And when rights violations, abuses happen, especially to environmental rights, there's usually little to no recourse for those individuals and their communities to seek justice. And those affected groups usually have limited resource to access these important institutions. So the effects of climate change on the full enjoyment of the right to health are already alarming. They are threatening human health and well-being by increasing causes of morbidity and mortality. Climate-related changes such as heat, drought, floods, hurricanes are associated with increased rates of cardiovascular disorders, respiratory, gastrointestinal, and renal problems. And environmental determinants such as pollen, smoke, dust, and stagnant water can lead to chronic ailments. And many of us know this firsthand. And so when we talk about the issues about environment and extraction, as someone that comes from South Africa, I used to be a mine doctor at some point in my life, and I know also firsthand the issues around mine workers, the respiratory illnesses such as silicosis and tuberculosis and other respiratory diseases, which led many mine workers and laborers to die, leaving behind many widowed women. And we know that the UN has also done a lot of work, and the Subcommission on Promotion and Protection of Human Rights, working group on forms of slavery. And so it's important to also think about the environment and the health of the environment without being essentialist about the family and the definition of family, but also recognize that some environmental health issues are actually exposures because of occupation. And so we ought to think about occupational health and labor rights as well as we think about environmental health and rights. And therefore, a lot of the problems that we are speaking about today are gendered, they are complex, and they are intersectional in how they exert themselves onto groups that are already marginalized. While the language, of course, of the Paris Agreement from 2015 is robust, a lot can be said about great disappointment at the levels of progress that has been made thus far, with increasing politicization of the issue of climate change and the denialism about it. And this has set back a lot of Indigenous communities' activism and advocacy. And we ought to think about the impact of COVID-19 on the environment and our ability to be, sustaining and taking care of the environment remains mind for me. And I would like to reiterate what I had mentioned in my Human Rights Council report of 2020, that as climate change intensifies, its destructive effects on the right to health and on the environment and human rights more broadly are being felt across the globe. Already groups in marginalized situations, including Indigenous people, children, older persons, persons in situations of poverty, migrant populations, and people with pre-existing health conditions are most at risk from climate change and the crisis we are facing, which threatens to exacerbate existing inequalities that many of these groups are already having to deal with on a daily basis. And these inequalities exist within countries and between countries as well. And of course, then the severe environmental changes have profound effects on the underlying determinants of the right to health, such as clean air, safe drinking water, adequate housing and food, economic security and social relationships, and community life. And when we talk often about violence and talk about healthy relationships, we often talk about the interpersonal human relationships, but I think it's important to talk about non-violence and non-violent relationships that actually also exist between us as humans, humankind, and nature. And climate change threatens that precious relationship and must be given more urgent attention. And I think it's important, especially as someone who works in sexual and reproductive health and who has been involved at different levels of policy making and coming up with programming around contraception and family planning, to also look at the impact of colonialism on sexual and reproductive health and how that intersects with the climate crisis that we face currently. And of course, in terms of colonial regimes, and we know that colonialism formally has ended, but coloniality continues to impact our life, and it continues to impact how societies are arranged, how knowledge systems are protected or not, or demonized. And it's important to also talk about the reproduction of people, fertility primarily seen as instrumentalist, and promoting it when it was deemed valuable for economy and economic growth and dominance of particular nations for political objectives, and how governments discourage it when they deem it undesirable, especially by certain population groups. And so we have seen historically how maternal health programs created by colonial powers in Africa, for example, and the Caribbean in the early 20th century were driven largely by perceived shortage of labor and people that needed to work on plantations and in export industries. And so it's very important to talk about many international organizations then who shifted to discouraging reproduction and promoting family planning in the mid-20th century when smaller families were deemed to be more conducive to national economic development and the very important global security, and how this idea of global security has then influenced a lot of foreign policy, and I would dare say some very harmful foreign policy when it comes to the funding and the financing of the global health space, especially related to sexual and reproductive health rights. And so the connections among fertility, family size, indigenous populations, and broader social and economic development continues to be debated. And I think the resurgence of rhetoric on population control in the context of climate change is something that we ought to look out for. And I think it's also important to talk about how the environmental destruction is often seen as something that poor people are responsible for. And you hear it in the languaging in public health, you hear it in the languaging in how people are encouraged to go for family planning. And recently I was very appalled, by one of the US universities who had a picture of a Black woman and a baby, just starting a fire to make a meal, to warm up a meal for dinner. And they were proposing that it's these types of cooking methods that were contributing to climate crisis, when we know that Africa contributes at most 4% of the global pollution, and yet nothing is said about industry that actually dumps plastic and environmental waste in the oceans in the African continent and other smaller developing islands, and to the detriment of those communities. So there's something about a decolonial approach that we need to assume and take on, as much as we talk about autonomy and full access to reproductive health rights. We have to be very careful in how we frame access to health. I think what's also inspiring for me is scholars and the activism of ecofeminists such as Professor Wangari Maathai, who best exemplifies multilocality. She was a scholar and activist who became the first African woman and environmentalist to win the Nobel Peace Prize. And I think to have this conversation without talking about these women would be a disservice. And such feminists give us a framework to think about human rights, to think about climate change, to think about environmental justice and how we hold governments and elected leaderships accountable. And to provide more clarity on this point, Maathai has shared with us this quote. She said, in a few decades, the relationship between the environment, resources, and conflict may seem almost as obvious as the connection we see today between human rights, democracy, and peace. And this particular section from her work is important because it gives us the lens that is necessary in viewing environmental work as urgent. And I think that's my call to action today, is that this work that we are doing is urgent and it's looking into the future and as a necessary democratic effort to achieve peace across the globe. And so the work done by grassroots movements, the work done by indigenous populations is important. And the knowledge production and the connection between the environment and humanity is very sacred, and it's something that we cannot downplay. And I think the environmental activism in some instances has seen to enable governments and elected leadership to want to relegate the responsibility of solving the climate crisis to civil society. And this is something that we also have to caution against. And of course, we also have to talk about, the impact of COVID-19 and then what it has meant in this context. And many communities from the global south, indigenous communities, communities of people of African descent, communities affected by poverty, have already been living in spaces that we're experiencing air, water, and land pollution, mainly led by industries and directly impacting their right to food security, safe water, and sanitation. And we've all often heard about the comorbidities around COVID-19 and why certain people tend to become sicker. And we know that, in fact, the American Medical Association has recognized racism as a very important determinant of health. And when you think about these populations I've just mentioned, they are already at risk of particular chronic respiratory disease that made them at increased risk of severe illness and death from COVID-19. So the pandemic can therefore not be used as a moment to take off attention from climate crisis. In fact, it's a moment for justice and to think broadly about what it means to live in a world that has protections to the right to health. And as my predecessor on the right to health once said, often the association of climate change and the right to health is limited to the impact on physical health, but the global community should pay more attention to its mental health dimension. Climate change is not only affecting human physical health, it is also impacting on the mental health and well-being of individuals and communities affected. And poor physical health and ailments are associated with poor quality of life and psychological distress. And I want to also challenge all of us that we need to make demands that take us beyond just survival. We need to demand quality of life. We need to demand accessible, affordable, acceptable solutions when we're thinking about climate change and the right to health, because it is more than just about accessing healthcare facilities. And the mental health component really, really is important. And in closing, I just want to say that in the previous and many interventions that I have been a part of, I have recalled and reminded states of their obligation that they must provide individually and through the framework of international assistance and cooperation, timely access to high quality, a rights-based support that is responsive to the particular needs of the persons affected by the climate crisis and the climate change. And that there must be integration into existing primary healthcare and indigenous healthcare systems, general health and social care services. States must take urgent measures to restore and to protect existing green spaces to support community connections with health and explore the creative use of environment to build relationships, including with the natural world, and facilitate individual and community healing. States have an institutional responsibility to offer support to people in ensuring that their environmental needs are met, that where extensive damage has been done, some restorative action is enacted, and that development does not occur at the expense of the environment. And above all, states have responsibilities to ensure that the people that live within its borders, regardless of their citizenship status, enjoy the highest attainable standard of physical and mental health. And this, I believe, is central to the work of restoration of dignity of people around the world. Thank you so much.
Thank you so much, Tlaleng, and thank you for so clearly setting out the health impacts of the climate crisis and really setting the scene for the next 9 days of discussion, so clearly the issues that we're going to focus on. So we're going to use our remaining time to have our students ask some questions to Tlaleng and Helen, and we're going to ask you quite complex questions, but with our limited time, really, I want you to solve the climate and health crisis basically in under a minute with your answers to each of these questions. So good luck with that. Let me briefly introduce the three students. Lubna Sharif is a final year Bachelor of Law and Media student at the University of New South Wales in Sydney. She has recently written co-written a fabulous report for the Australian Human Rights Institute on making right to health a reality. And she is out there representing the Australian Human Rights Institute at UNSW. Dr. Sikambuzu Mabunda is a South African public health medicine specialist, a PhD candidate at the University of New South Wales, and a research institute representing the George Institute for Global Health. And from USC, we have Jessica Santos, who is a fourth-year undergraduate chemical engineering student in the School of Engineering and a first-year Master in Public Health student in the School of Medicine's Department of Preventative Medicine at the University of Southern California. So, Lubna, over to you. I'm going to ask you to ask your first question to Helen.
Hi, Helen. So the COVID-19 pandemic comes at a time where there has been considerable pushback by states against multilateralism and international approaches. But the pandemic has also demonstrated what can be achieved when governments, business, and experts work against a global threat. Which aspects of the global COVID-19 response should be used to tackle the climate emergency? And what can the COVID-19 response reveal about how we must prepare to protect and promote the right to health under a climate emergency?
Well, I spent most of the past 18, 20 months pretty focused on COVID and the response. And in a nutshell, the global response hasn't been as good as it could be either. But at least it got global attention. It's got a certain amount of global action. We're nowhere near there. Look at the gross inequities in access to vaccine and therapeutics as an example. But the immediacy of it, at least galvanized some action. And I think that's really the kind of spirit we need around climate action. That it's not something that's happening sometime in the future, something scientists are talking about as a possibility. It's happening now, and it's having an impact. So it's bringing that sense of immediacy, and I think also relating it to health is critical. The pandemic touched each of us because it was a threat to our health. We have to communicate that climate change is a threat to our health and well-being. As human beings, what matters, nothing matters more to us than our health and well-being. So framing it in the terms that you're framing it at this conference, I think will be a critical part of getting the kind of response and action we need.
Thank you so much. And that is that point where we're trying to think about how we treat climate change like a disease. What should our responses be? Sikambuso, could you ask your first question to Tlaleng?
Thank you, Justin, and good morning, and thank you to all the speakers. Dr. Mofokeng, mine is related to the fact that climate change is exacerbating a number of health conditions, including malaria, diarrhea, and malnutrition. Studies suggest that a response to this disease will be costly to human life and governments, particularly in resource-poor settings, as you highlighted in your presentation. What strategies are in place to address these challenges in the short, medium, and long term?
Hi, thank you so much for that question. And it's an important one because we've seen with the pandemic, it was an emergent dynamic and rapidly evolving health emergency, that there were resources and finances and human resources that were diverted from other primary health care and tertiary health services. And that went towards COVID management. And then, of course, it made sense. But it exposed how fragile our health systems are globally. And the fact that when we were dealing with COVID and responding to it, we kind of let the ball down on many other important, especially primary healthcare services. I think what's important is to actually start looking and demanding more transparency and accountability in terms of where health expenditure actually happens. Because it's one thing to see the budgets of many countries, and when you look on the surface, it looks like everybody is responsive, everyone is thinking about these issues that you've mentioned. But when you look at the actual expenditure, that's where you really see where the failures are. And I think the maladministration and the corruption within many health systems across the world, developing countries, developed countries, it doesn't matter where you go. I think it's a big problem that actually holds us back from getting the desired health outcomes. If you look at how much total global health aid goes in the different regions of the world, it makes no sense that we still don't get the desired health outcomes. And I think what's important for me is to have meaningful engagement of civil society and let communities set their own priorities. If you get programs being designed out elsewhere, right, by people who are, of course, the experts in public health, but they're not the experts in the daily lived realities of those communities. And there may be a discrepancy between what the communities see as urgent and how they envision the problem solving and versus what the program designers and the funders want as targets, as indicators. And I think to bridge that gap, we need to have more community involvement and meaningful engagement at all levels, at all stages of planning around health programs and health services. Thank you.
Thank you, Jessica. Would you follow up with your first question to Tlaleng?
Yes, hello, Dr. Mofokeng. Thank you for your presentation. So my question for you is, addressing issues of population and development is critical for reducing the impacts of climate change, but focusing on the effects of overpopulation often leads to unproductive conversations. How can we shift the global conversations towards prioritizing sexual and reproductive health and rights as a part of the solution to climate change?
This is an important one, but it's a political one, right? Because the interest often in the fertility and reproduction of women and people capable of getting pregnant, feeds into essentialism around gender, right? And around womanhood. And like I referred in my statement, when a lot of people speak about the youth, right? They talk about the youth demographic, and it almost sounds like they're investing in the youth because the youth are the next people to be in the labor market, but not because they are truly invested in the human rights broadly of all youth and making sure that the youth can transition healthily between childhood and adulthood, right? Just as one example. I think for me, it's about autonomy. It's about the politics of who gets to decide when I have children, how many children, and to decide on pregnancy outcomes. We have to talk about, I suppose, also the history of wars in this world and the fact that to be a dominant nation in this current system we live in, and why wars are started and why they are maintained, you need soldiers. You can't be an imperialist and not have soldiers to actually do that work. And so it's very political. It's very, very political. The issue of extraction of raw materials from the African continent is a political issue, right? And so when you blame women in poor communities for having children, yet no one is talking about the fact that those very communities cannot sustain themselves because of capitalism. There's nothing fundamentally wrong with wanting to have a child, but it's the socioeconomic, it's the communities we've created and the global world we've created that some people are unable to actually exercise their rights, whereas others are enabled and actually encouraged and even given social support and funding to make those decisions, such as having more children. So it's a very political one, but I hope I've kind of started to answer it, but it's multifaceted. Yeah.
Thank you. I mean, everything about climate has turned political, I think, with our discussions now. So we're almost out of time, but Lubna, you have a question for both leaders, and perhaps if you pose it to Helen first, and then Tlaleng will look for your answer. We're almost out of time, so Lubna, over to you.
Yes, so big question. In 10 days, COP26 will bring together world leaders to discuss the next stage of the climate crisis. If you had the full attention of every world leader for 1 minute, what would be your key message on why human rights and health need to be centered in climate action? Helen, to you first? Yeah, Helen, to you first, please.
Well, my message would be, look at the impact of what is happening on the people of your country and the wider world. This is not an abstract issue. It's not something that might happen. It is happening now. It's affecting your people. When Scott Morrison, for example, goes representing Australia to that conference, think of the heat waves, think of the fires, think of the floods, think of what's happening to the Great Barrier Reef, think of the impact of climate change on your country, its ecosystem, and its people. That would be what I'd urge.
Let's hope that message gets across. And finally, Tlaleng, what would be your message to the leaders at COP26?
I think it's important to remind them that human rights are interdependent, but I also want to remind them the same way that COVID has shown us existing inequalities and compounded them, we have to center people who are already marginalized. And those people are not only dealing with everyday life and survival, but they are also dealing with conflict, with ill health, with inadequate and fragile public health systems, and they are unable to cope, right, with the threat of multiplying effects of climate change. And one of the ways of ensuring that we come out of this pandemic and we survive is to make sure that everyone everywhere has access to the COVID-19 vaccine. That is another crisis that is deliberately being created, and we cannot talk about health environment without healthy people and vice versa. Everyone has to do their best to make sure that we get vaccine equity. Everyone everywhere who requires that vaccine should be able to get it with the utmost of urgency. Thank you.
Thank you so much, and that provides us actually with the perfect segue into the next session, which will be held tomorrow and led by Sophia, which is looking at the discriminatory impacts of climate change. I want to thank you all, particularly Dr. Tlaleng Mofokeng and Helen Clark, for your insightful comments which are connecting climate and health. And in this next 9 days, we're really trying to connect those issues around discrimination, inequality, and equity, which are at the heart of sort of global health inequalities. Human rights have to be the forefront of the climate debate. So we're hoping to urge our call to action over the next 9 days. We're hoping that you will join us for those discussions. Thank you also to Jessica Lubner and Sekumbusu for your interventions today. And we look forward to involving the audience in the next 9 days with all of our sessions. Thank you for joining us today. On behalf of USC, the Australian Human Rights Institute, and the George Institute, I'm really thankful that we're co-convening and curating this conference, and we look forward to further discussions over the coming week. Thanks very much.